So now to share some key highlights from our project, may I request Professor Yeoh, Director of the Center for Health Systems and Policy Research at Chinese University of Hong Kong, to come on the stage. Thank you.
Where's the PowerPoint?
I think they will do it from the
Okay. The Honorable Dr. Lam, Dr. Pang, Dean Chiu, Samuel, Dr. Rex Wong, Mr. Linda Lam. It's a great pleasure for me to give a brief overview of the project, but I think you've already heard so much from our colleagues in terms of what they've done. It just remains for me just to highlight in the very brief period about what we've done and what we intend to do, and the framework for this to happen. You can see that in an ethnically diverse community, how can we identify and address the health challenges faced by South Asian communities in Hong Kong? That's our project. The project looks at a biopsychosocial spiritual model for health, because these are related. I think what you've heard just now about the spiritual needs, spiritual is not just religious. Religious needs is just one representation of our spiritual needs. It's about things which are important to us as human beings, the meanings, our health beliefs, and all these are interacting. So it's that concept of in systems where we have complex systems, and these are facets of our human beings in terms of the things that affect our well-being. So it's psychological, biological, social, and spiritual. And the framework is in community academic partnership and community-based participatory action research. You've already heard much of the work, and I won't go into the details. And obviously this is important because we have the Hong Kong Jockey Club Charities Trust, who has been really very supportive in funding the first phase and now on the second phase. And very importantly also our community partners, the Hong Kong Christian Service, Hong Kong Seng Kong Hui Lady MacLehose Center, the Hong Kong Seng Kong Hui Welfare Council, and the Neighbourhood Advice and Action Council, right? And the approach is obviously looking at a life course. And it's particularly important because the social determinants affect life course, but for our ethnically diverse communities, it's even more important because many of them have relocated during their lifetimes. So things have changed, and some of these things can be enabling, or can be barriers to good health, and they're cumulative over a lifetime. So like parental influences in childhood and nutrition developments, self-esteem, access to health education, social stability, gender norms, and culture and religious influences. Of course, all these change when people relocate. And the acculturation period is so important, especially for many of our ethnic groups who have relocated. Some were born here, some came to Hong Kong, and those things continue to be dynamic and change. Just briefly, what they've achieved and found. We have, obviously, in the first phase, done assessments of 1,700 adults and 300 children, many health promotion workshops, capacity building, and then many of the life modification and chronic condition management programs, which I won't go into detail. But what we found was quite important, that we found, obviously, obesity was very, very highly prevalent. Over 3/4 of the populations were obese, compared to only about 1/3 in our local community. And more importantly, abdominal obesity. Abdominal obesity was even more prevalent. Over 83% had abdominal obesity. And of course, we understand that it's associated with other metabolic disorders. So many had hypertension, diabetes, hypercholesterolemia. And also, we had found a very high prevalence of anemia in women. And these were really some of the acculturated projects. When people relocate, they do not have the same access to the types of diets that they had before. And of course, also pregnancies, multiple pregnancies, very close, also affected the anemias. And many of, obviously, especially for high cholesterol, were undiagnosed previously. So obviously, after the assessment, we had the follow-up measures and follow-up programs, which I won't go into detail. But just want to highlight that many of the programs were really designed with the community, especially the type 2 diabetes management group, where we had the people in these ethnic groups in the group where they supported one another and designed the programs which were useful for them in terms of diabetic control. These were some of the publications. I won't go into detail. These were all written by Gary and with our colleagues. And then we now also identified in our assessments a service gap for mental health, and that's why we're in phase 2. We're obviously using the PHQ-4 surveys. We found 9.4% had depressive symptoms, 14% had anxiety symptoms. And most of this were mild, but however, there were some which were moderate and severe. And about 1/3 displayed mild to severe levels of psychological stress. Just now, you already heard that we have got many services for our population. However, there are barriers both on demand and supply side. There's lower health-seeking rate compared to general population, cultural difference in interpreting mental health, stigma and reluctance to express emotional needs, peer and family pressure discourage service use. And on supply side, we have a lack of ethnically diverse friendly language support, passive outreach by providers, and hesitation of service providers to target the ethnically diverse populations. So that's the reason why we've now moved on to our phase 2. So objectives is to improve mental health service access. Access is important for ethnically diverse communities through mental health programs and intervention programs, improving health literacy by promoting changes in health-seeking behavior with families. And the third arm of this is the capacity of social and health service staff to be culturally sensitive to the needs of ethnically diverse communities, which is a very important component on the supply side. Our overarching programs, when we look at the comprehensive program, we do health assessments for people with moderate and severe symptoms. They are referred to NGO partners, and it's important that we generate knowledge. So we use a quasi-experimental approach to evaluate the outcomes. For mild cases, we use group interventions by our own team and with the NGOs, and using a randomized control trial to evaluate the effectiveness. For people who are mentally well, we still want to improve their mental health by low-intensity psychosocial interventions. We use group-based approaches by our team, and also for pain management, because it's one of the important facets for some of the stress that many of our clients face. And then mental health promotion programs, also with our NGO partners, using randomized controlled trials and quasi-experimental methods for evaluation. So our co-production, it's important that we have this concept of the co-production, because the programs are designed and implemented with our clients. So they're not things that we're dictating. So these are things which are appropriate for them. So we work with our clients and with our partners in this approach. So, yeah. And capacity building, as you know, is important in terms of building a culturally sensitive workforce. So these are some of the programs that we'll be going to do. And more importantly, since Dr. Pang is here, we are collaborating with the district health centers. As just now you heard, we have been working very closely with the district health centers to develop cultural competence in primary healthcare settings, joint health assessments. We had a pilot program with the district health centers on the type 2 diabetes management group, And then we also work very closely with our partners in the district systems. And finally, our long-term goal is connectivity of our ethnically diverse community with our primary healthcare ecosystem. So we pass it on to Dr. Pang Fei Zhao and our district systems in the future. Thank you very much.
Thank you, Professor Yeoh, once again. JCSATH is ready to make a real difference in our Phase 2 project.